Now, the interesting thing about breast cancer is that hormones play a big role in that. And which hormones do you think play a big role in breast cancer? Maybe the ones that lead to the development of mammary glands. So, hormone receptors can actually increase the growth rate of tumors, especially estrogen receptor alpha, which is activated by estradiol among the other estrogens, and progesterone receptor. So, hey, those are two that always cycle on in the menstrual cycle, and these are two receptors. If they're in a tumor, well, if a woman's having her menstrual cycle and the increases in these in estradiol and progesterone, it's actually going to cause the growth of this. So both of these receptors will trigger the growth of these cancer cells. There's also another receptor that's not linked to the steroid hormone receptor growth, but there's another type of receptor that's associated with increased aggression in breast cancer. Now that might sound scary, but the thing is that it's also important for treatment. So what they can do is like often things like aromatase inhibitors, which prevent the conversion of androgens to estrogens. That's going to impede the activity of estrogen receptor alpha. They also have anti-estrogens and anti-progestogens as well. So the cool thing is like even if a breast cancer tumor, if untreated, if it has these, yeah, it's going to be more aggressive. But the cool thing about knowing this endocrinology and whether these receptors are present is that you can give targeted chemotherapy. Instead of chemotherapy that kills cells in general, you can give an anti-estrogen, you can give an anti-progestogen, you can give a drug that targets the HER2 receptor. So even though untreated, these are deadlier, you are able to actually target and be more selective and more accurate in killing these breast cancer cells if they're like what we call ER positive or PR positive or HER2 positive. Then you can target these and target those cancer cells without really affecting normal cells as much. Now, there's another type of breast cancer called triple negative breast cancer, and it refers to these three receptors. So, say you have a breast cancer and it doesn't have estrogen receptor, it doesn't have progesterone receptor, and doesn't have HER2. That's why they call it triple negative. Now, the thing is that with triple negative breast cancer, well, now you can without the presence of these receptors, well, you can't use anti-estrogens, you can't use anti-progestrogens, you can't use anti-HER2 medications or treat antibodies. So typically, what you see in these breast cancers is that they have to use general chemotherapy because you can't target these receptors if they're not there in the cancer. So that's what triple negative means. And risk factors. So the thing about breast cancer is most diagnosed in women over 50 years old. So it's not something we see in younger women, but doesn't mean that it's impossible for a younger woman to get breast cancer. And I think like one of the records I heard, and it's not a record you want to send, it was a local woman, and I think she developed breast cancer at 25. So it is possible to develop breast cancer at a young age, and this is why she was pretty much everyone was surprised because they're like, you typically don't see that. Genetics also plays a role as well. So family history. If you have if your mother has breast cancer or if a sister had breast cancer, your risk compared to the general population is you're more at risk of developing breast cancer than other women who don't have a family history. So there are many family genes that have been like linked to breast cancer. The most famous ones are BrCa1 and BrCa2, which are DNA repair proteins. But they're not the only genes. There just happen to be some of the first ones that were just discovered. So I think, what was it, Angelina Jolie, she has this mutation in BrCa1 and BrCa2, or one of them, or both. And it increases her overall risk. If women who have this mutation, they have an increased risk of developing breast cancer. Yep. So, and then also your ancestral background as well. So the interesting thing is that there are disparities in breast cancer rates. Just like how I mentioned, like black men are more likely to develop prostate cancer along with Polynesian men. Well, breast cancer also has similar disparities. And the interesting thing is that in general, Asians have a lower rate of breast cancer, but that's taking all Asians across all countries and ancestral backgrounds. Interesting thing is that Filipino Americans have an increased risk of breast cancer compared to Chinese and Japanese and other Asian backgrounds. So what we see is an increased risk of breast cancer in the Philippines. So they're all from Asia, but even though the overall rate is low, we see an increase in that. So it's very interesting too, because in this study, they said like not only are Filipina more at risk of breast cancer, it's also like factors include cumulative menstrual months. Interesting question, and I actually have a slide for that. So interesting thing is that it's not just about genetics and ancestral background, but age of menarche. So if a woman starts her first period at a younger age, that actually increases her risk of developing breast cancer, or it's associated with the increased risk of breast cancer. Now, menopause, when a woman stops ovulating, she no longer has follicles that can develop and ovulate. Well, this all start if you have menopause later in life, that also has an increased risk of breast cancer as well. Well, think about it this way: if you this is like a typical like the like time in a woman's life where she has her periods and menstrual cycles. Well, if age of menarche gets earlier, that means that she has more months and more time in that menstrual cycles, or multiple more menstrual cycles. And if she has later menopause, she has more menstrual cycles. So what does that mean overall if you have a earlier menarche and a later menopause? Well, this is what they mean by cumulative menstrual months. And hey, what hormones are constantly cycling during the menstrual cycle? Estrogens and progesterone. Hey, what are also important in breast development? Estrogens and progesterone. So this is why they think how many menstrual cycles and months you have on the menstrual cycle plays a role in a risk of breast cancer. And this one is a very interesting. So if a woman has a later pregnancy, or if she's never been pregnant in her life, that also seems to be associated with the increased risk of breast cancer. And I think they're still trying to pinpoint why that happens, but it's very interesting. It's still the most common, not including skin cancer. Skin cancer is the most common cancer, period. Breast cancer is still the most common cancer in women, but now, so I think like maybe it was like the former CEO of Susan G. Komen. She said like, why isn't this research being done enough? Like, why haven't we solved breast cancer yet? Well, thing is that just as we saw with the multiple receptors and different types of breast cancer, it's all affecting the same organ, but there are multiple, when you get down to the receptors and hormones and genetics, the problem gets a lot more complicated. The good thing is that we are slowly winning the battle. Like, it used to be the deadliest cancer in women, and that's why it's often devastating for women who experience breast cancer. And but now I think lung cancer is now the deadliest cancer for women, and breast cancer is number 2. So even though it would be great if breast cancer was completely solved, we are kind of getting more treatment. So will there be a single cure for breast cancer? Probably not, but we are finding more treatments and cures, plural.